Hey guys, Dr. Derry here, owner of Revision Health Services, and today I want to talk about back pain and will it heal on its own. There are some things to consider to know if your back pain is going to heal on its own, so hang with me for about 2.5 seconds. I'm going to go over those top things that I see in the clinic. Alright guys, so I want to start off by saying that not all back pain is treated equal. And so when I see patients and they have different types of back pain, where we notice that everybody's experience with back pain is a little bit differently, but the first thing to consider is it's not all created equal. Some people just have like a spasm-like discomfort, some people have back pain and leg pain, and some people have like weird symptoms associated with their back pain. And it can be upper back or mid back or lower back or into your buttock. And so not all back pain is treated equal. We really don't know, and we're not super good at telling where back pain is coming from, but will back pain heal on its own? When I'm looking at that patient, I figure, okay, do they need a little bit of care or they need a lot of care? Because I'm like, maybe it'll heal on its own. I look at what type of pain that they're experiencing, and so it's a good sign if you're having that achiness, that dullness, the movement-based pain into your buttocks or your back, and so we know those are all good prognostic factors. Are you motivated? Are you confident that it will get better? Are you staying laid up in bed, or are you staying active and just listening to your body? So those are all factors to consider if knowing that back pain will heal on its own. Most of the time it does heal on its own, so that's a good thing. But when I look at this patient that's in front of me, I'm like, okay, do they need lots of conservative care? Do they need to see imaging? Do they need to do injections? And so will back pain heal on its own? Most of the time, yes it will. And so if you have some of those factors that are in your favor, most of the time back pain does heal on its own. It just needs what we say time. Time heals a lot of wounds, and we know that 90% of people get better with back pain in the next 4 to 6 weeks or so. And so most of the time we're in that 90% of that group, and we just need some assurance, and we know that back pain will improve, but we just kind of got to get through it. And so what factors are stacked in your favor? So are you trying to stay active? Are you treating your body well? Are you still moving despite the discomfort? All of those things we try to consider in knowing that if your back pain is going to get better. Another thing that I look at is like, how do we, when we are talking about back pain, do you have pain with movement? And so when you're moving, does that pain change? And so if you're laying or sitting there on your couch or wherever you are right now, how's your back discomfort? And then once you get up and walk and bend over and lift things up, how's your back discomfort? Most of the time, we have a slight change in our pain with movement. And so it may be good with some things or poor with others. And so that movement change is a really good sign. And so we know that the tissues in your back, if we were to do an image when you're feeling really well, and do an image like when you're doing something that is really uncomfortable for you, would you have a change in your structure in your spine? Probably not. That movement-based discomfort, that ebbs and flows, that ups and downs is a good sign, which tells us that your tissues are healing still, and some movement feels well and other movement doesn't feel as well. And so we need to work into those ranges and areas that do feel well. And so time will do really well. Does your pain change with movement? And how are you treating yourself when you're having that discomfort? Are you still moving? Are you still working? Are you still doing the things that you want to do, but just modified? And so those are all things that I try to consider if back pain will get better on its own. Most of the time it does, 90% of people it does. And so that's just what we see. That's what the literature shows. That's what we want to tell people in the clinic. And it may not be the best news ever to receive while you're in there. Be like, hey, you just need some time. There may be some things that you can do in your favor, to help encourage that healing, but it will get better. But when you're in that moment, you can be in the weeds. It can be really uncomfortable, but will back pain get better on its own? Most of the time, yes. So just hang with it, right? And so just do what you can, listen to your body, and just stay moving and take care of yourself. And so I want to continue answering questions like this. Feel free to subscribe to the channel at any time and leave any comments if you would like. Otherwise, stay healthy, keep moving, and